this video, we'll share a chrome guided smile case, a standard chrome, with a few twists. There are a few unique things that happen during this case that we think that you will find interesting. When the case arrived, it just had these three photos, and of course we always want to have a full face, full smile picture, and then a picture with lips at rest, and profile pictures if there are class 2 or class 3 considerations, lip support, that type of thing. But in this case, just these photos came, and we accepted them. They are used for articulating the case. You can see this is a deep class 2, and the patient will need to be opened. And normally, we ask for a JC trien to be designed, fabricated, sent to the doctor. JC trien is this product that essentially opens up the bite and confirms the bite. The doctor will seat these, ensure that they're seating perfectly, just like a partial, and then equilibrate and confirm that that is the centric bite, the correct vertical, or the doctor can do a centric CR bite or any other type of bite that would put the patient in the right position, and then physically send back the JC trien or triens and a bite registration for us to re-articulate. In this particular case, these were digital impressions, and the doctor was very confident in the bite, and so we printed the models, and then we articulated. As you can see here, this is a virtual representation of it, but it was printed, and then as you can see, the case was opened up about 3 millimeters. And with these opened casts, we will complete a setup for the surgical guide planning to put teeth in the right place. And as with all of our chrome meetings, we meet online, live session with the doctor, plan every implant, every site. There are some extra STLs in here that we're going to talk about in just a minute, but we plan the case live and ensure that everything about the case is exactly as the doctor wishes, and then we fabricate. One of the tools that we use for surgery is this instructional tool called the SurgiMat, and this is designed to be taped or pinned to cabinet in the surgical room for at-a-glance information during the surgery, cross sections, information about the guided kit. In this case, is a Straumann BLX system, so there are handles, tools, which tool to use, H4 here, and all the instructions needed to guide the doctor through surgery, even notes from the planning session. Extract number 10 prior to placing the pin guide. There's probably some malocclusion. So this goes on the wall. The SurgiMat is printed and placed on the counter, and the doctor will place the implants, the specific implants, literally on this form, on this sheet. Place the different abutments. You can see here 13, 17, 17, 30. So you put the correct abutments on here, and then 2 sets of temporary cylinders. So this is a really handy tool to use during surgery. And the case is fabricated. When we make a chrome case, there are 5 days and 10 days involved. In general, it's a 5-day, 10-day rule. When all the records are received, we take 5 days to get them prepared for the online meeting. And during that time, maybe day 2, day 3, the doctor will receive an email. And that's if we have all the correct records. If not, we'll be in contact. But if all the right records come in, then within 5 days, you'll receive an email. You'll click, there's a link. The link will take you to our website where it is schedule an online meeting, and you'll scroll down and you'll pick the type of meeting. In this case, this would be a chrome single arch. Then you can either pick the day or you can pick the technician. We have a few different technicians. And you'll pick the time, and then you'll add in some of your details, who you are, your email, the patient name, etc., and you'll just accept it, and it'll send you an invitation for your calendar. It's a very handy, quick tool to use to schedule your own online meetings. And on this case, most of the procedures go as planned with all chrome cases. The pin guide and the carrier guide are, the pin guide and the fixation base are delivered together. You ensure that the pin guide is seated. We put windows on it, occlusal windows, to make sure that the guide is seated at the teeth. Then it is removed, and then the doctor makes a labial flap only. Perhaps a little bit of a lingual flap, but mostly it's a labial flap because chrome has a very small footprint. Labial flap only. This case did not have a lot of photographs because we really wanted to share the specific issue with the minimal vertical space. So we're kind of jumping ahead here. The bone has been reduced down to the level of the fixation base. This is a fixation base, serves a few purposes. It is supports the osteotomy guide, supports the carrier guide. It gives an indication for the bone leveling. The top of the fixation base is where the leveling should be. So the bone is leveled, the surgical guide, the osteotomy guide goes in, the osteotomies are created, and then the implants are placed, and again, skipping way ahead, and the temporary cylinders are inserted. Now, not totally sure why there was so much adjustment on these temporary cylinders. Perhaps it was trajectory. I don't think so. These are pretty straight. This one has a little bit of a deviation here. As you can see from the plan, there would have been a little bit of deviation here on number 8, number 7, number 8, whichever implant that is. But otherwise, very consistent with the plan. And then at this point, this is where there's something a little bit different. Now there is a carrier guide initially for indicating where to rotate the implants, but then the carrier guide is removed and the prosthetic is connected directly to the fixation base because there isn't space, vertical space, for a carrier guide. So I'll show a little demonstration here. This is the fixation base and the prosthetic connected and direct. And that's okay. We've made this a few times over the years. And the technique, though, is a little bit different because now these struts, these arms, have to be removed from the prosthetic. And this video here will show how those are removed. You just simply disc them off, and you don't want to cut.
Yeah, let's see how that works. Do not cut it all the way through because you don't want to touch the teeth. You can just...
That is our friend James Anzalone, who performs a lot of chairsides with us, and he's an expert. But the bottom line is that remove these arms and don't disc all the way through because you don't want the disc to contact the pink because then you'll have to fix it. So just simply remove the arm and then just use a handpiece and adjust this smooth so it's contoured, and then polish. And glaze if you'd like, but really a nice high polish works just fine. And then the prosthetic can be delivered. Now this one has already been picked up. You can see in the very beginning here, the prosthetic has already been picked up. Once it's removed from the mouth, cut the arms off, and then go through that process of finishing it. You can see here a very, very nice job of filling the holes. I believe some of that metal will still be disced off. And then the intaglio. And notice there's no female holes here from the carrier guide because they're not needed. So overall, very nice result, very nice case. And thank you for watching another Chrome video.